for several years. And speaking of a great organization, it is a great honor to welcome our next guest, my colleague, Peter Berns, CEO of the ARC of United States. And he has been with us many years in a row. He is the nationally recognized Chief Executive Officer of the ARC, the world's largest community-based organization of and for people with intellectual and developmental disabilities. He's been at the helm of the ARC since July 2008, strategically managing a national organization with 600 state and local chapters across the country. Under his leadership, the nearly 70-year-old organization has charted an ambitious course of progress, innovation, and change as it aims to achieve its mission of promoting and protecting the human rights of people with intellectual and developmental disabilities, and actively supporting their full inclusion and participation in the community throughout their lifetimes. It's always a pleasure to work with Peter. He's a great leader for all of us at the state levels as well. And so please welcome Peter Berns, who will be giving us an update on the national disability movement. Welcome, Peter.
Thanks, Jordan. It's really great to be here with everyone. Thank you so much for that kind introduction. And it's my pleasure to be with you at the 15th Annual Disability Policy Conference. Looking forward to next year. Hopefully we can be in person. So I have a lot to share in 30 minutes, so I'm going to jump right in. But before I do, I really would like to, on behalf of the ARC's National Board of Directors and our national staff, I really would like to offer our best wishes to you and really hope you're doing as well as can be expected in these challenging times. You know, I have a few topics that I'm going to talk about today, and I'd like to leave some time at the end of the session for questions. I'm going low tech today, so no slides. You're just stuck with me for the next 20 plus minutes, 25 plus minutes. So if you have questions, write them into the comment area and we'll come to them towards the end of the session. So let's talk about the United States Congress. If getting things done in Congress wasn't challenging enough during the hyper partisan climate we've been living with the past 10 years, it's even tougher this year. The fact is, this is an election year and time is running out on the 117th Congress. There are only about 6 months left before the midterm elections, and then a short lame duck Congress after that. So as advocates, we really need to stay focused. The first area that we need to focus on is on long-term services and supports, and particularly Medicaid, home and community-based services. As I talked about when I was at this conference last year, in early 2021, we scored a major victory, winning $12.7 billion in funding for home and community-based services as part of the American Rescue Plan. And since then, and continuing into this year, we've been working to build on that success. We've all been advocating this past year in favor of the budget reconciliation legislation, what used to be called the President's Build Back Better plan, which would, among other provisions that are important to people with disabilities and their families, it would have provided $150 billion, that's billion with a B, $150 billion in new investment and funding for home and community-based services. And we were all thrilled when, as a result of our advocacy, the Build Back Better plan passed the House of Representatives, but then were extraordinarily frustrated when it failed to pass the Senate. Well, we're still expecting to see a new budget reconciliation bill come out of the Congress, and we were encouraged when we heard President Biden mention Medicaid, home and community-based services during his State of the Union speech. We continue to work very hard behind the scenes to make sure that the budget reconciliation bill includes additional funding for home and community-based services. The home and community-based services funding is vitally important to address the workforce crisis, to expand access to services for people who are on waiting lists all across the country, and those who are receiving services but not getting all that they need. We're also working really hard to see if we can get some improvements to the SSI program into the budget reconciliation bill, such as increasing the asset limits and increasing the earned income disregard. But because of the rules around budget reconciliation, there's not more that can be done to address some of the other issues in the Social Security disability insurance and SSI programs. Now, while we're on the subject of budget and funding levels, the administration released its proposed budget for fiscal year 2023, which begins October 1st of this year, 2022. And we were really pleased to see that the president proposed substantial increases in funding for many discretionary programs that are important to people with intellectual and developmental disabilities and their families, chapters of the ARC and other service provider organizations like UCP, affiliates of UCP and Easter Seals. For programs in our priority areas in the Departments of Labor, Health and Human Services, and Education, the president proposed more than $4.3 billion in increased spending across 32 different programs that are important to our community. The majority and the biggest increases are in education, with an increase of more than $2.9 billion in funding for state grants for special education, more than $90 million in preschool grants, more than $435 million in early intervention programs, and $155 million in school personnel preparation, all under the Individuals with Disabilities Education Act, which we all know as IDEA. There's also about $230 million in additional services for vocational rehabilitation state grants. So the advocacy message here is you need to engage with your members of Congress and talk with them about budget reconciliation and talk with them about the administration's proposed FY 2023, fiscal year 2023 budget. So stay tuned for more information as we learn more of the details of what's included in the budget reconciliation bill. And I'm sure the ARC of California is going to push out information as we pass it along, or you can sign up to receive our national policy alerts at thearc.org/action. So let me turn to another piece of legislation that's really important for you to have on your radar screen and on your action agenda this year. It's called the Work Without Worry Act. It's Senate Bill S-2108 in the U.S. Senate and House Bill H.R. 4003. This is one of three bills we're working on that are intended to make improvements in the Social Security disability insurance and SSI programs, and the one that we think actually has a good chance of moving forward during this term of Congress. The Work Without Worry Act will help people with intellectual and developmental disabilities to do just that, to work without worrying about losing their benefits. And it will do that by eliminating what is one of the big work disincentives for people with disabilities. So what's the problem? So bear with me a little bit because this is a bit complicated, but I'm going to try to explain it as simply as I can. Right now, people with a disability who have a disability that began before they turned age 22, who are not able to work at a level to sustain themselves, may be eligible for what's called Disabled Adult Child Benefits, or often referred to as DAC benefits. DAC benefits are often more generous than SSI because they're based on the parent's Social Security work records. DAC eligibility is a way to ensure that an adult with disabilities, son or daughter, adult child, that indicates the relationship, not the age, that adult child with disability will still be supported even after a parent becomes disabled themselves, retires, or passes away. DAC eligibility is unavailable until it's triggered by the parent's use of Social Security. And generally speaking, at that point, many adults with disabilities rely on SSI benefits, which, as most of you I'm sure know, are means tested. They have strict asset and income limits. So unfortunately, navigating these different programs and these rules are extremely complicated for people with disabilities and their families. Most important, if a young person with disability has countable earnings over even $1 over what's called the substantial gainful activity level, or the SGA level, that's $1,350 a month in 2022. If they have even $1 over the SGA level before receiving DAC benefits, they lose their DAC eligibility forever. And so this, as you can imagine, creates a disincentive for people to work, particularly for young adults with disabilities, who may want to try working but aren't sure of their capacity. They're not sure if they're going to be able to work enough to support themselves. There are many circumstances where a young person with a disability might be able to earn over the current limit for a short period of time, or perhaps every now and then, but be unable to sustain that over the course of their lifetime to support themselves. And families often worry that if the wrong amount of work is going to cause their family member to lose DAC benefits, perhaps it's best that their son or daughter with disabilities not work at all. That's a lot to worry about. So what will the Work Without Worry Act do? It would eliminate this work disincentive. It would allow young adults with disabilities to try and work and see if they can support themselves without losing eligibility for disabled adult child benefits. Earnings from work over the SGA level, substantial gainful activity level, will not prevent the individual from receiving DAC benefits on their parents' work history, as long as that individual remains disabled by the same condition that they had before age 22, and they continue to meet the other eligibility requirements. And their benefit amount will be either the benefit from their parents' work history or from their own work history, whichever is higher. So the advocacy message here is, if this legislation, the Work Not Worry Act, begins to move, you're going to need to engage with your members of Congress and tell them to support the Work Without Worry Act. So stay tuned again to the ARC California's email alerts, or you can sign up directly at the arc.org/action. Now, I'd like to turn next to another big problem that's looming on the horizon that you need to know about and be prepared to take action. As I'm sure you know, we've been living during what is officially declared a public health emergency. And that public health emergency has been going on since January 27th of 2020. It's currently scheduled to come to an end on July 15th, 2022, unless it's extended again, which at this point seems pretty unlikely. So why is this important to know? The reason is that there have been a number of COVID-related changes to Medicaid and Medicare policy and practice that were in effect during the public health emergency that will not apply once the emergency is lifted. And this can really have far-reaching impacts for people with disabilities. First, this can affect Medicaid eligibility. Under the Families First Coronavirus Response Act, signed into law in March of 2020, additional Medicaid funding was provided to states in exchange for their committing that they were not going to drop people from the Medicaid rolls. Medicaid, of course, in California, we're referring to Medi-Cal. But once the public health emergency is lifted, states are going to need to redetermine the eligibility for everybody on their Medicaid rolls, and they're going to have 12 months to do that. And the concern is that tens of millions of people nationwide, estimates are it could be as many as 2 to 3 million Californians, that they will lose their Medi-Cal coverage in this process. And that could be because their situation's changed, or it could be that people are just going to get so lost in the paperwork shuffle that it's going to cost them dearly. So as advocates, you need to stay on top of how the state of California, and in the case of folks whose Medicaid eligibility is tied to SSI, how the Social Security Administration, how they manage these redeterminations. As you're advocating for yourself, your family members, or others to navigate this process, there's some practical steps you can take as well, and important information to keep in mind. First of all, All Medicaid beneficiaries should make sure that the Medicaid agency has your current contact information, postal mail address, phone number, and email address to make sure the paperwork gets to the right place. Second, you should monitor, for advocates, you should monitor to make sure that the Medicaid agencies are providing renewal information in plain language in a way that is accessible to people with limited English proficiency and people with disabilities, as they are legally required to do. Information from Medicaid agencies should be available in multiple languages and with free oral translation for people. And for people with disabilities, states should provide appropriate aids and services at no cost to make the materials accessible. Third, in terms of health insurance, people who are no longer eligible for Medicaid will also have other coverage options. So as states perform renewal and redetermination actions for people on Medicaid, they're supposed to work to ensure that anybody who continues to be eligible for Medicaid under a different eligibility category, that those people stay enrolled, and that if you qualify for a private marketplace under the Affordable Care Act, that you're transitioned smoothly. And there can be further complications in this area for people with disabilities who are dually eligible for Medicare and Medicaid. And it's important to understand that if you're denied coverage, everybody has a right to a fair hearing. And that help's available from Disability Rights California, local legal aid agencies, and pro bono lawyers. There's also a lot at stake for folks who are getting their home and community-based services because they're Medicaid eligible. So it's also important to stay on top of what other services are provided through state-only funded programs or through other federal programs like the Older Americans Act, the Centers for Independent Living, the Assistive Technology programs, and VOC rehab programs. So we also need to continue our advocacy for voting rights to preserve the right to vote for people with disabilities and those who are from other marginalized communities. In the beginning of January, the House of Representatives passed the voting rights legislation that combined the John Lewis Voting Rights Act and the Freedom to Vote Act. And although it made it out of the House, it failed in the Senate. We at the ARC and our state chapters in Georgia and Texas are involved in lawsuits in both of those states to prevent the enforcement of new laws that would make it harder for people with intellectual and developmental disabilities to vote, harder for people with disabilities as well as people from other minority communities to exercise their right to vote. But we can't rely just on litigation. We need to keep the pressure on Congress to pass the voting rights legislation that is pending. So the final topic I'd like to talk about is a finding from some research we've been doing with the Harris Poll and what it says about the importance of storytelling. In preparation for my talk today, I pored over all of Jordan's Monday morning memos from the past 6 months. And I read with interest the new series of stories you're calling We Are the ARC Family, those that have been featured in the Monday morning memos and on ARC California's website. And thanks so much to Pat Hornbecker and Mary Platt and Grace Huerta and Betsy Katz and Joe Metters and Sandy Waterbury, and most recently Crystal Pugh, for telling your family stories over the past weeks. And for all of you who are willing to do so in the weeks and months ahead. What you're doing is incredibly important, but I have one additional suggestion for you, and that is that you need to spread your stories far and wide, not just inside the disability community. It's folks outside the disability community that need to hear your stories. So why is that? The reason is that most members of the public have no idea what you're experiencing day to day, week in and week out, and over the years. So how do we know that? Well, here's where I'd like to share with you one of the findings from some marketing research we've been doing with Harris Poll. And we will be sharing more of the results from this research in the weeks and months ahead. and at the Summer Leadership Institute of the ARC's National Conference of Executives in Chicago in July. But last year, we contracted with Harris to help us learn more about what members of the general public think and understand about people with intellectual and developmental disabilities and their families, and how that differs from our understanding inside the IDD community. The good news is there's broad public support for people with intellectual and developmental disabilities and their families to be provided the supports they need. 9 out of 10 people who took the survey from among the general population, by general population, we meant here people who are not do not have are not a person with an intellectual disability or do not have a family member with an intellectual or developmental disability. 9 out of 10 agreed with the statement, quote, "Society has a responsibility to provide the supports that people with IDD need." Now, that's great news. But we also discovered what is a big obstacle to our achieving more progress for people with intellectual and developmental disabilities and their families. The problem is these same members of the general public don't know that the needed supports are not there. Nearly 4 out of 10 think that there are, quote, "plenty of supports and resources in our society for people with intellectual and developmental disabilities and for family caregivers." And another 3 out of 10 were just not sure. It was only 3 out of 10 that had a realistic view, that understood that this is a problem, that not all the supports that people need are there. So that's our challenge. And that's why telling your story is so important, and why you need to tell your story in every community you're a part of, not just in the disability community, but in the workplace, in your place of worship, whether it be a synagogue, a mosque, or church, or other spiritual setting, in your community center, or whatever community organizations you're a part of. As Robert McGee has written, storytelling is the most powerful way to put ideas into the world today. Now, before I open it up for questions, I'd like to close with a couple quotes. First, from a social entrepreneur and author, David Bornstein. And he wrote, "An idea is like a play. It needs a good producer and a good promoter, even if it's a masterpiece. Otherwise, the play may never open, or it may open, but for a lack of audience, close after a week. Similarly, an idea will not move from the fringes to the mainstream simply because it's good. It must be skillfully marketed before it will actually shift people's perceptions and behavior." So too with our vision, that people with intellectual and developmental disabilities are valued members of their community with the opportunity to realize their full potential and a future that is secure. It's a good idea, perhaps a masterpiece, but it will not move from the fringes to the mainstream just because it is good. It is up to us to do the work needed to shift people's perceptions and behavior and make it a reality. And as Susie Kasim has written in her book, Rise Up and Salute the Sun, to really change the world, we have to help people change the way they see things. Change has to be psychological. So if you want to see real change, stay persistent in educating humanity on how similar we all are than different. Don't only strive to be the change you want to see in the world, but also help all those around you see the world through commonalities of the heart so that they would want to change with you. This is how humanity will evolve to become better. This is how you can change the world. The language of the heart is mankind's main common language. So I'm going to stop there and let me thank you for having me and see if we can open it up for some questions that you can write into the comments.
Thank you so much, Peter. Really amazing updates on what's going on at the federal, national level. And I think we do have some questions for you.
Yes. Okay, so there was a question about the status of work without worry. And so that bill has been introduced in both houses of Congress, and it actually has bipartisan support. What we're working to see happen. So one message here is go online and look and see if your member of Congress has signed up as a co-sponsor on this bill, because the more co-sponsors we can get, the better. So if not, encourage your members of Congress to sign on as co-sponsors, either the House bill or the Senate bill as appropriate. And then next, what we're working to make happen is to have this legislation attached to some other legislation that is likely to go through during the course of the year. You know, it's not likely, a lot of times in Congress, bills are introduced individually, but the way they move is they get combined with something else. And we think there's a good chance, you know, there will be some bills that are must-pass bills that have to get done before Congress adjourns. This Congress is adjourned. And so we're looking for an opportunity to have this attached to another bill that may go through. So encourage, you know, and we will let you know if that is happening, and then you can encourage your members of Congress to support that legislation. Let me see, are there other questions?
One from Denise really asking if you could give a quick description of the difference between Medicare and Medicaid.
Okay. So Medicare is a health insurance program that is attached to Social Security insurance benefits, to old age survivors and disability insurance benefits. You know, so as people become eligible for Social Security, and you can become eligible for Social Security because you hit the age threshold, or you could become eligible for Social Security because you develop a disability during the course of your lifetime, or you're the spouse of or survivor or someone who is receiving benefits. And Social Security benefits are based on your earnings history during your working life. And Medicare is the health insurance program that is attached to that. So when you become eligible for Social Security, you know, for example, at age, I just turned 65 this past year, and I became eligible for Medicare. Medicaid is a different program. It is also a health insurance program, and it is for people who are low income. And there are both, you have to be below both asset limits. You can only have so much in your bank account, and you have to have very low income in order to qualify for Medicaid. And Medicaid, so one thing that people often do not understand about Medicare is Medicare does not cover long-term services or any type of long-term care. Medicaid is not only is it a source of health insurance, so, you know, it pays for hospital care and doctor's visits and the like, but Medicaid, what you know as Medi-Cal in California, is also the largest source of funding for home and community-based services for people with disabilities and for other types of long-term services and support. So Medicaid also pays for nursing home care, for example, or intermediate care facilities. But we do a lot of advocacy around Medicaid because it is the single biggest source of funding for home and community-based services that people with intellectual and developmental disabilities and their families need.
That's a great quick summary. Thank you, Peter, so much. Peter Berns is a great, incredible leader for the developmental disability community across the country, and for the ARC, especially across the country, and all the chapters, and really all the different programs and all the different far-reaching tentacles that you're involved with, and the ARC is involved with, is it really impacts the lives of individuals and families in so many ways. So Peter, once again, as always, we thank you for joining us for the conference.
Well, thank you too, Jordan. You guys really rock in California, so keep up the great work.
Thank you, and I'm sure we'll be hearing more from you soon, and we'll share it through the networks.
Great. Have a great rest of the conference.
Thank you. Peter Berns, CEO of the ARC of California. That was incredible.